Since March, life as we know it has stopped. Ever since the coronavirus started to spread, the American government has started to push the use of masks on its citizens. This has caused an uproar everywhere. Why should the government be able to tell its citizens what to do with their bodies? How can they expect us to wear masks that are only going to make us sicker because masks ruin your immune system, right? Why would scientists even think that masks could possibly stop the spread of a virus? Because they are just a piece of cloth. Instead, they are just encouraging you to breathe in your own CO2, which is only going to make you sicker in the long run and decrease your lifespan. American citizens have been outraged by mask mandates. All around the country, many Americans have felt like it was their patriotic duty to stand up to mask mandates and protest their use. Many Americans think that the use of masks is a new concept that the government created to take their rights away. Americans have a history of protesting masks, though. During the Spanish flu, citizens were asked to wear masks, and the American citizens responded very similarly to how they are now. They led anti-mask protests and started anti-mask groups. But what many American citizens now do not know is that this was not the first instance of masks being protested in the US. These anti-mask protests were a little bit different, though. At the time, the use of face masks to stop the spread of the disease was fairly new. Doctors had only been using them in a hospital setting for about 10 years. In fact, when surgeons were first asked to wear masks, many American surgeons just simply refused. They claimed that they were restrictive and uncomfortable. They thought that there was no way that they could help the survival rate of their patients. As a result, they led their own protests by refusing to be pictured with them and refusing to wear them over their noses. Eventually they came around, though, and face mask use is now a standard policy that all surgeons must follow. The idea that surgeons were once allowed to operate on people without face masks is a very foreign thought, but if American citizens truly believe that masks do not prevent the spread of germs, then maybe surgeons should just stop using them. Overall, this would be great for their well-being, right? Surgeons would live longer lives because they are not breathing in their own CO2, their immune systems would be stronger, so they would get sick less often. Then this would actually prevent more patient deaths, since masks wouldn't stop from, the surgeons from spreading their own germs anyways. So having a higher immune system would overall be more beneficial for the patient. So overall this would just be a win for everyone involved, right? If you said yes, then let's talk about this and think about why that might not be right. I'm going to describe a scenario to you. You need open heart surgery. You meet with your doctor before surgery. You do your routine pre-op conversation before you go back. You notice that your doctor has really bad tuna breath. So that means he has not brushed his teeth since he last ate. In 20 minutes, he's going to be standing over your unprotected heart with numerous other people in the room. They're all going to be breathing, talking, maybe even laughing near your open chest cavity. You don't know. They might even sneeze or cough, and they're not going to have a way to cover their mouths or nose because they can't do this and cover them because they have to keep their arms sterile. You know that they had to sterilize their arms and their hands before they went in to operate on you, but you don't know if they had to use mouthwash, sanitize their mouth. Obviously, your doctor hasn't been brushing his teeth, so that's a little concerning. So think about that. Also, just think about the fact that a healthy person has over 700 types of bacteria in their mouth at all times, and that's assuming they brush their teeth regularly, which we've already discussed your doctor isn't because he's meeting you with tuna breath. And that you're also assuming they don't have any type of bacteria or infection in their mouth that's different than the normal bacteria that would be in their mouth. So take a moment and think if you would really be comfortable with a surgeon operating on you while they weren't wearing a mask, because there's a reason that they've been using them for over 100 years. They didn't just do it because they wanted to. They did it because, obviously, they helped their patients and they stopped the spread of diseases. So now that we have discussed the fact that masks probably are pretty effective at stopping the spread of germs, or else surgeons wouldn't use them and they wouldn't have been using them for the past 100 plus years, I think we can get into some demonstrations just to prove how effective they are. So the first demonstration is a spray bottle being used to spray a liquid onto a face mask. As you can see, it just bounced right off. It doesn't go through. And so that would be similar to like you sneezing or coughing. And then to prove just how effective face masks are, I poured a blue Gatorade onto a face mask, and as you can see, it doesn't go through the face mask, it doesn't leak. The face mask holds it as if it were like a cup, and I think this just proves how effective they are, because most people think, oh, they're just a piece of cloth, they can't stop water from going through, let alone like the water droplets from when I'm talking, sneezing, coughing. But as you can see, it does not leak at all, and there is not a doubt in my mind that the use of mask would greatly prevent the spread of germs.